Welcome to The Explainer. Today we're jumping into a really important meta-analysis, one that pulls together a ton of research to look at the incredibly complex factors behind child sexual abuse perpetration. We're going to explore what the data tells us about how offending develops and, what that all means for prevention.
So just to understand how urgent this is, let's start with the sheer scale of the problem. A major national survey back in 2005 by Finkelhor and his team found a pretty shocking statistic. 82 out of every 1,000 kids had experienced some form of sexual victimization in just the past year. This isn't some rare thing happening on the fringes. It's a massive public health crisis.
You see a number that big, and it just forces you to ask some really tough questions. Why? Why does this happen? And maybe the most important question of all, can we stop it? For a long time, prevention was all about teaching kids how to protect themselves. But think about that. It puts this huge, completely unfair burden on the potential victim. So in recent decades, researchers have flipped the script to a much more effective approach. Let's try to understand the developmental pathways of the people who actually perpetuate the abuse.
Okay, so here's our game plan for this explainer. First, we're going to frame this whole issue as a preventable problem. Then, we'll get into the specifics of the research we're focusing on today. After that, it's a deep dive into the risk factors. First looking at origins and actions, then at the mind and society. And finally, we'll tie it all together and see what it means for prevention.
So let's start by really establishing why understanding perpetration is so critical if we want to build prevention strategies that can actually, make a real difference out there.
The real engine behind all of this work is the deep and lasting harm that victims experience. Countless studies have shown just how devastating the consequences are. They cover everything from psychological trauma like PTSD to social and behavioral problems like substance abuse and even physical long-term health issues. This reality just highlights the absolute urgency of preventing the abuse from ever happening in the first place.
Okay, let's get to the core of what we're talking about today. The 2008 review by Whitaker and his colleagues. Now, this was a huge deal. It was a major meta-analysis that systematically combed through 89 different studies published since 1990. It gave us this incredibly comprehensive look at what all the evidence was telling us.
And this quote right here, it gets straight to the heart of their whole argument. The main idea is that putting the entire burden of prevention on children isn't just unfair, it's just not enough. Especially when the data shows that most abuse is carried out by relatives and acquaintances, people a child already knows and trusts.
Now, this shift in thinking didn't come out of a vacuum. It actually built on some really important earlier theories. For instance, David Finkelhor's super influential 1984 model proposed this kind of four-step pathway. It suggests that for abuse to happen, there has to be first an emotional connection with children, and second, sexual arousal towards them. This gets combined with a third piece, a blockage from having appropriate adult relationships, and then finally, a breakdown of internal or external barriers, what he called disinhibition, that allows the offending to actually happen.
Now, to really analyze all this data consistently, the researchers has to use very precise language. The main group being studied is called Sex Offenders Against Children, or SOC for short. You're going to see this acronym pop up a lot, so it's good to know it refers specifically to this group. Getting this definition right is absolutely key for comparing findings accurately across all those different studies.
So, how did the researchers figure out which factors were unique to SOCs? Well, this is where the methodology gets really clever. They didn't just look at SOCs all by themselves. No, they compared them to three other distinct groups: sex offenders who targeted adults, or SOAs, offenders who'd committed non-sexual crimes, and then a control group of non-offenders. This comparison is so important because it helps filter out general criminal behavior and really zero in on the specific risk factors for child sexual abuse.
The Whitaker Review took all those findings and organized them into 6 big categories of risk factors. We're going to walk through these in 2 parts, starting right now, with factors that have to do with a person's background and their observable behaviors. What the review ultimately found is that risk doesn't come from just one place. It's not that simple. Instead, it's this complex web of factors that fall into 6 key areas: family factors, externalizing behaviors, internalizing behaviors, social deficits, sexual problems, and finally, attitudes and beliefs. So let's go through each one. First up, family factors. The research is really clear that what happens in a person's own upbringing is a huge predictor. We're talking about things like having a personal history of being abused, having really poor relationships with your parents, being exposed to harsh discipline, and developing what psychologists call insecure attachment styles in childhood. Okay, the second category is what's called externalizing behaviors. This is all about observable actions, things like violence, delinquency, and just general antisocial conduct. The research here really digs into a key debate. Is sexual offending a very specialized, unique behavior, or is it part of a much bigger pattern of antisocial actions?
The third category kind of flips the coin and looks inward. It focuses on internalizing behaviors. This covers things like psychological states, depression, low self-esteem, and also a person's inability to manage stress or cope with tough emotions in a healthy way.
All right, let's move on to the next set of risk factors. This is where we start to build a more complete picture, moving from someone's history and their outward actions to their inner world and how they function socially.
The fourth category that they identified is social deficits. Here we see that just having a hard time with basic interpersonal relationships is another major risk area. This can show up as poor social skills, deep loneliness, and this one's really critical, a lack of empathy, or the inability to really understand other people's feelings and perspectives.
Fifth, we have what the review calls sexual problems. This category is all about those maladaptive sexual behaviors and interests that are, directly linked to the crime itself. This includes having a specific sexual interest in children and the presence of deviant sexual fantasies.
And finally, the sixth category looks at attitudes and beliefs. This is about the mental frameworks, the internal justifications, the twisted thinking that people use to allow, excuse, or minimize their own abusive behavior. This is where you see things like attitudes that are tolerant of rape and specific rationalizations for the abuse itself. So, altogether, these 6 categories give us a pretty comprehensive map of the developmental risks.
So what's the big takeaway from all of this? I mean, identifying all these risk factors isn't just some academic exercise. It points us directly toward concrete, evidence-based strategies we can use for prevention.
So what does this mean for intervention? Well, the research suggests that because a lot of these risk factors, like family problems or poor social skills, are actually common to lots of bad outcomes, broad interventions can have really powerful effects. For instance, programs like the Positive Parenting Program or Parent-Child Interaction Therapy, things that help improve parenting skills, can be really effective. Same goes for school programs that teach kids and teens better social and emotional skills.
And this really leaves us with a final and pretty challenging thought. This knowledge isn't just neutral information. If the research can actually shine a light on the pathways and identify the risk factors that lead to offending, it creates a moral and a societal imperative. Our responsibility then becomes to use that knowledge to develop, to implement, and to support effective, evidence-based prevention before the harm is ever done.